feeling tired, unmotivated, or struggling with sleep? You might be missing the signs of low cortisol. Keep watching because in this video, I'm sharing the 5 most common symptoms and how to treat low cortisol naturally using functional medicine. Recognizing the symptoms of low cortisol is important for more than just getting relief. Low cortisol and burnout are linked to a 21% increase in cardiovascular disease risk and an 84% increased risk of type 2 diabetes. And studies show that nearly 60% of women and 45% of men report burnout symptoms like fatigue, low mood, and disrupted sleep. In this video, I'm going to share the top 5 symptoms of low cortisol that I've seen in over 15 years of practice. And I bet the last one will surprise you. I'll also share my favorite functional medicine strategies for treating each low cortisol symptom at the root cause. But first, you need to understand what cortisol is, what it does in the body, and how it's regulated. Otherwise, none of this will make sense. Cortisol is a hormone that is produced by the adrenal gland in response to stress. That stress could be mental or emotional in nature, like childhood trauma, a demanding workload, or the everyday stressors of parenthood. But stressors can also be physical, like eating lots of sweets, catching a nasty virus, or having a chronic condition like IBS, hypothyroid, or endometriosis. Stress isn't just in your head. It's a very real, very biochemical process that involves a super complex cascade of neurological signals and chemical messengers, including cortisol. When we face a stressor, the brain signals to the adrenal glands to release cortisol via the HPA axis. And cortisol interacts with the cells of different body systems to prepare us to fight or flee from danger. The HPA axis really shines in situations of short-term or acute stress, but too much of a good thing can become a problem. If stress becomes chronic, or we're faced with stressor after stressor on a daily basis, cortisol can stay high for too long. This turns the helpful survival function of cortisol against us, resulting in weight gain, type 2 diabetes, digestive issues, high blood pressure, and immune system problems. High cortisol is a problem, but if left uncorrected, elevated cortisol turns into depleted cortisol. This is how it happens. When your HPA axis is cranking out lots and lots of cortisol for a long time, your cells adapt to those high levels by decreasing their sensitivity to cortisol. Here's an analogy that I find helpful. My sister has 4 amazing kids, and they make a lot of noise. When I visit, I am very responsive to all of those sounds. My sister, on the other hand, has adapted to the constant noise and has much less reactivity to it. It's not that she doesn't hear her children and she's not ignoring them. She's just responding appropriately to the noise because it's her typical learned environment. Same goes for your cells when they're overexposed to cortisol. They turn down their responsivity little by little over time until the brain turns down its signal to release more cortisol and levels drop off and flatten out. When cortisol levels are low, sometimes wellness experts refer to it as adrenal fatigue or adrenal exhaustion. But it's not as if your adrenal glands can't make cortisol. The brain, as part of the HPA axis, is instructing your body to make less cortisol because it's not effectively lowering the stress input. It makes sense if you think about it from the brain's perspective. What's the point of making all this cortisol if it's not actually going to relieve the stressor? But it's not the same as having Addison's disease, a rare condition where the adrenal glands are injured or incapable of producing enough cortisol. That requires a different approach than we're talking about, though it certainly can be equally confusing to figure out. While the symptoms of low cortisol are all too common, accurate testing is rare, which means that conventional medicine often misses or even ignores the root cause. You have to go beyond simple blood testing when you're checking cortisol, because cortisol levels fluctuate greatly throughout the day, and a single blood test doesn't take that into account. Also, there's a difference between free cortisol levels and metabolized cortisol, and don't get me started on free cortisone. All that to say, a comprehensive urine cortisol test is the best way to figure out if your levels are low. This is actually a common mistake that I see people make. They're taking all sorts of remedies intended to lower their cortisol levels when it turns out they're already too low. Thankfully, we help people all over the world get access to accurate, actionable, at-home testing for cortisol problems. The test I use is much more than just a cortisol test. It measures over a dozen different markers of adrenal function, and I'll even help you interpret your results and figure out how to actually fix your specific cortisol problems once you have all of that actionable data. Check out the link in the video description for more information and to order your test kit. We ship internationally. All right, the first symptom of low cortisol on our list is fatigue. This can present as mental fatigue and include brain fog, poor memory, and loss of focus. Or it can be physical fatigue and include sluggishness, feeling like your body is heavy, and loss of endurance or stamina. Most people don't talk about this, but you're actually getting two symptoms for the price of one here, because most people with low cortisol also experience weight gain secondary to fatigue. Dr. Google will tell you that folks with low cortisol experience unexplained weight loss, and that may be true in extreme circumstances, but I've seen the opposite more often. My favorite way to boost energy and support low cortisol when fatigue is dragging you down is a blend of adaptogenic herbs that improves cortisol sensitivity, stimulation, and prevents adrenal atrophy from chronic stress. The first ingredient is the most famous of all adaptogens, Panax ginseng. It's one of the oldest herbs used in medicine, originally in China and other parts of Asia. Ginseng works on the stress response system from the top down, as well as from the bottom up. Next on the list is Cordyceps sinensis. Its claim to fame is strengthening the body after long-term stress, exhaustion, or illness. The last adaptogen in my favorite blend for low cortisol is Rhodiola rosea. More than 180 published studies support its efficacy in improving cognitive function and increasing physical capacity. This herb is great for improving brain stamina, efficiency, and reducing mental fatigue. Like many adaptogens, ginseng, cordyceps, and rhodiola tend to work best as a team. I'll put a link to this product and my other favorite nutraceuticals for low cortisol in the video description. Simply click the link, sign up for a free account to my Fullscript dispensary, and they should pull right up. You'll find some nice surprises waiting for you as well. The second symptom of low cortisol is low mood. This includes low motivation, apathy, and other symptoms of depression. And like fatigue, it can also lead to weight gain. It can be a really frustrating, vicious cycle. One thing to remember is that low moods can also be a sign of low estrogen. Recent research suggests that estradiol supplementation is more effective than SSRIs for treating depression in menopause. I see low cortisol and low estrogen overlapping a lot, often resulting in fatigue, low mood, and low motivation. While the adaptogens I already talked about can be helpful for boosting both energy and motivation, I also like to support mood directly with SAMe, or S-adenosyl L-methionine. SAMe is important for maintaining positive emotions, and it supports production of the happy hormones in our brains, otherwise known as neurotransmitters. It isn't found in your diet. Instead, your body makes it from an amino acid called methionine and other cofactors like B vitamins, a process that can be tricky for folks who are already depleted. My clients find supplementing with SAMe can be helpful in boosting mood, motivation, and self-regulation, especially in the darker months of the year, as it's a great support for those who suffer from seasonal affective disorder. The third common symptom of low cortisol is low blood pressure, especially orthostatic hypotension, where your blood pressure drops when you go from seated or lying down to standing. This can cause dizziness, lightheadedness, and even fainting, and it's one of the most common sneaky signs of low cortisol and burnout that I see in practice. Licorice root extract, specifically glyceric acid, can be helpful for boosting abnormally low blood pressure. It works by helping your body reactivate inactive cortisone into free cortisol, supporting higher circulating activated cortisol levels. My clients with POTS actually find it really helpful for this reason, but you need to carefully monitor your blood pressure levels while taking licorice root extract. And if you already have high blood pressure or are taking medication to treat high blood pressure, licorice root is not for you. Also, be careful not to get this confused with deglycyrrhizinated licorice, or DGL, which is used to support and soothe the lining of the stomach and GI tract. The fourth common symptom of low cortisol that I see in practice is disrupted sleep. Despite a deep sense of fatigue, many people with low cortisol struggle with insomnia. This happens because their normal free cortisol curve, which is supposed to rise and fall throughout the day, is flattened out, which disrupts their circadian rhythm. Because changes in cortisol levels aren't signaling when they're supposed to be awake versus asleep, many folks have very low energy and a lot of sleepiness during the day, but they wake up in the middle of the night and can't go back to sleep for hours, tossing and turning. This actually happens because of high cortisol at nighttime. Yes, you can have cortisol spikes even if your overall cortisol levels are low. My favorite sleep support nutraceutical focuses on regulating cortisol rather than sedating you to sleep. It includes ashwagandha, L-theanine, magnolia, and phosphatidylcholine to calm the mind and blunt cortisol spikes right away. It helps you fall asleep faster and stay asleep, and it's non-habit forming, so you can safely take it every night. The best part is that this formula also reduces stress symptoms during the day. The fifth symptom of low cortisol that you might be surprised by is skin hyperpigmentation, particularly of the gums, lips, in areas where skin creases, and areas of scarring. While less common, this darkening of the skin results from high levels of ACTH, adrenal corticotropic hormone, and melanocyte-stimulating hormone, which can stimulate excess melanin production in certain areas. When cortisol levels are this low, it's often associated with primary adrenal insufficiency, also known as Addison's disease. And in these cases, treatment with glucocorticoids help the hyperpigmentation fade over time. But topical application of aloe vera, licorice extract, vitamin C, and plant extracts can also control melanin production, helping lighten hyperpigmentation. I'll put a link to my favorite third-party tested dark spot serum with the other cortisol supportive supplements in the video description. While these are the top 5 most common symptoms of low cortisol that I've seen in my nearly 2 decades of working with clients, you may also experience low blood sugar, indigestion, muscle and joint pain, low libido, and irregular periods if your cortisol is below optimal. If this is sounding familiar, a comprehensive urine test for cortisol could be a great next step. Otherwise, feel free to try some of my favorite strategies to boost energy, mood, and motivation. You deserve answers, and you deserve relief. I hope you found this video helpful. Thanks so much for being here, for supporting my channel with your likes and subscribes, and for spreading the word about the work I'm doing. I appreciate it more than you know. We'll see you in the next video.